Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for our radio audience here in Mississippi, WYAD 94.1 FM, and WYADonline.com. We're glad that you all could be with us. Also, tuning in to our online affiliates around the world, including our friends at iHeartRadio and Amazon Music Podcasts. We're glad you all could be with us as well. Well, one of the things we talked to you guys about last fall was about the changes that you all could have made to your Medicare coverage plans. Well, millions of Americans took the opportunity to do just that. But now's the time to be proactive and making sure that you're getting the most out of your Medicare coverage. Here to help you guys with that, we're excited to welcome Dr. Philip Painter to our program. Dr. Painter is the Chief Medical Officer at UnitedHealthCare, Medicare, and Retirement. He's going to give you guys some great tips that you guys can take into this fall as well as the winter as well. Dr. Painter, thank you so much for the time. Really appreciate it.
Well, great. Listen, thanks for having me.
So this is really exciting for us because we did talk to our audience before, Dr. Painter, about the importance of taking out the time last fall to be able to check their plans and make sure that they were getting the coverage that they needed. How today can our audience be more proactive in taking advantage of the benefits of their plan?
Yeah, well, exactly right. I mean, it's a new year, and as you said, many people have new health plans, and so it's really important that they take the time to understand the coverage of those health plans and what their benefits are. And I would say a great place to start is, since it's a new year, think about what preventive or screening things you may need to have done. Do you need a mammogram? Do you need other cancer types of screenings or other preventive care? What do you do for? And then start to get those arranged. It's a great thing to do at the beginning of the year. And Medicare health plans have really good coverage around preventive and screening care. So that's a great place to start. And then I would encourage people, since they have a new plan, to look at what extra things might be covered. And for example, Medicare Advantage plans and plans like UnitedHealthCare have additional coverage for things like vision, dental, hearing, over-the-counter medications, even healthy foods. We have a program at United called Renew Active, where our members get membership to fitness clubs, which is a great thing to think about, to start the new year. And we even have a program called House Calls, where we'll send a nurse practitioner into our members' homes to do a comprehensive assessment, kind of help you plan out your medications, other things you may need to do for the year to keep you healthy and get the care you need. So I think those are really good places to start. Make sure you understand, as you said, your benefits and how to take advantage of those things.
And it is some good tips for our audience, Dr. Painter. The other thing, of course, that people are thinking about, especially with rising inflation, is making the most of each and every dollar, right? And so I have to ask you about tips when it comes to managing their healthcare costs. Do you have any ideas and tips for our audience when it comes to that, how they can make sure that they are being able to take advantage of the options there?
Yeah, you're exactly right. And I would say the place to start there is, first, understand your plan and your benefits and what your cost shares are for specific services. So do you have a cost share? Do you have a copay for certain things that you want to do for your primary care doctor, for specialist visits, for other things that you may want to do? And do you have what's called a maximum out-of-pocket limit on your spend? For example, original Medicare plans don't have a maximum out-of-pocket, so it's a little tougher to plan how much you may be exposed to spend during a year, where Medicare Advantage plans like those through UnitedHealthCare have a maximum amount of out-of-pocket spend. So a little bit easier for you to look at your finances and understand and plan what you may have to be exposed to for spend for the year. And then, moving on from that, I would say prescription drugs are a place people are very often concerned about. Medications can be very expensive, and that's another area you can look at to better understand and trim some of your spend. And I would say three things there. One is you may be eligible to get, through your plan, home delivery of your medications. Not only is that convenient, but it also lowers your cost in many instances. And then I would say look and see if some of your expensive medicines could be potentially moved to generic medications. Now, certainly that's a conversation you want to have with your doctor to make sure that moving to a generic medicine may be right for you in your particular instance. But it is a way to save money on your cost share or co-pays around your medication. And then lastly, make sure your local pharmacy is in the pharmacy network of your plan. If you use an in-network pharmacy, typically that lowers your cost share or co-pays for your medication. So I think there's many ways that people can understand their plans better, look at their cost share or co-pays, and there's a chance for them to maybe at least reduce or keep under control some of their health costs for the coming year.
Painter, those are some great tips. So as we mentioned in the beginning, I mean, now that they have their Medicare coverage, making sure that they're able to get the most of that. And I love the tips you shared with us here. Again, everyone, Dr. Philip Painter has been our guest. He's the Chief Medical Officer at UnitedHealthCare, Medicare and Retirement. Dr. Painter, where can our audience go for more information?
Easy way. Look at the back of your ID card from your health plan. There's oftentimes a phone number on there that you can call for help or assistance. If you have a UnitedHealthCare plan, you can go to uhcmedicarehealthplan.com or call 1-800-220-6808.
Dr. Painter, thank you so much again for the valuable information and the time, and looking forward to speaking with you again.
Great. Thanks for having me.
Hey, glad to do it. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.